Hello and welcome to NCTV episode 43, and this one is about pregnancy related pains and what you can do to either prevent or manage them. So where to start? I appreciate this is a vast topic, so the first thing to say on the matter is that body aches in pregnancy are usually a completely normal reaction to the changes your body is going through. Why do they occur? Well, there are two main reasons. And the first is because of the body's changes that it's going through, meaning that the extra weight that you're putting on due to the bump is increasing pressure through the muscles and the skeleton. And two, because of your hormones. As these amp up, they start to relax your ligaments, which changes your posture and your centre of gravity to accommodate the growing fetus, while at the same time causing weakening of the abdominal walls and increasing strain on the muscles, which results in a combination of body aches and pains. When it comes to body aches in pregnancy, the most common complaints are definitely back and pelvic pain, with figures suggesting it can affect up to 80% of women who are pregnant. Other areas and joints that can be affected are the legs, hands, feet and head. As weight gain or swelling from fluid retention occurs, this puts pressure on your joints and nerves. Symptoms vary from person to person and may be dependent on their activity level. Pregnancy body aches and pains may be worse at the end of the day or in a very active mum-to-be who has fatigued muscles, or it may be worsened by certain positions like moving from a sitting to a standing position, sitting in an uncomfortable chair, or being stationary for a prolonged period of time, either seated or standing. Aches and pains can occur at any point in pregnancy, but they're often most bothersome during the third trimester, since the baby is bigger at that stage of pregnancy. So how to ease and prevent the body pains during pregnancy? The best way is to keep active and keeping your weight gain in check. It's recommended that women of a normal BMI gain between 25 to 35 pounds or 11 to 16 kilograms in total. But even if you are already suffering from discomfort, moderate exercise like walking has been shown to reduce pregnancy-related back pain. Other great activities you can do to help reduce your aches, improve your mood, circulation and sleep, as well as help control your weight, are swimming, Pilates and yoga. And whilst on the topic, it's a great idea to strengthen your pelvic floor through Kegel exercises to support your bladder, bowels and uterus. The way to do that is by contracting the muscles that you would use to stop the flow of urine, then holding this for a count of 3 seconds and relax. If you do that 10 times and 2 or 3 times a day, then that would be good. Whilst body aches in pregnancy are considered to be normal, it's a good idea to still talk to either your doctor or midwife about them at your next appointment, as it's better to be safe than sorry, especially when pregnancy is concerned. If, for example, the aches are really severe, restrict your movement, and include swelling or redness in the legs, then this could be a possible sign of blood clot, so the sooner that you get it checked out, the better. It's also worth noting that pregnancy aches and pains usually affect a particular region in the body instead of all over, and they're not particularly associated with other symptoms like fever, chills or a cough. So if you have any of those, you may be suffering from a cold or flu, in which case give your doctor a call about it too. Coming back to back pain now, and some of the measures that you can take to help reduce pain is to maintain good posture when you sit, stand or move. And this can be assisted by wearing flat shoes to evenly distribute your weight, invest in a firm mattress to support your back, lift from your knees instead of bending, and sleep on your left hand side. Putting a pillow between your legs and under your tummy too can also provide extra support. When it comes to treatment of aches and pains in the muscles and joints during pregnancy, whilst biased I know, it would be amiss of me not to mention osteopathy, of course, for gentle hands-on relief to enable a more comfortable pregnancy as your body adapts to the changes. Other alternative therapies people tend to find work well are physiotherapy, acupuncture, massage, chiropractic and reflexology, to name a few. Aside from exercise and alternative therapies, one of the best forms of self-help that you can do is in the form of rest and relaxation, which can be easily overlooked and underutilised in this day and age when everything is go, go, go. You can achieve this by stretching, deep breathing, listening to music, having a warm bath, reading, or even sleeping. This is just as important as exercise, and it will help to reduce stress, anxiety, tiredness, and fatigue, as well as helping to reduce muscular aches and blood pressure. So if you found this useful and know of anyone who is currently pregnant and may benefit from this advice, feel free to share this with them, the video that is. And if you'd like more information, I've written a couple of pregnancy-related blogs on my website on the matter as well, entitled, one is 10 tips to keeping healthy whilst pregnant, and the other, osteopathy in pregnancy. So I'll provide the links to these articles in the description below if you're interested. That's all for now. See you next time for some more bite-sized bits to help your health flourish. Bye-bye.